Welcome all nursing officers to exam preparation part 4. If you didn't watch the previous parts, please watch it through the link given in comment section. Today's topic is diseases and science. This topic is based on important and frequently asked questions about diseases and its science in various exams like ESIC, JIGMAR, AIMS, HARD exam, etc. Due to the large size of this portion, the portion is divided in two videos. Same as in other exam preparations, this video also has 3 parts. First one is multiple choice questions, second one is topic presentation with animation or pictures, and the third one is memory tricks and tips. Let us go to the multiple choice questions. Read the questions carefully and select the right option. Answer key is given at the end of the session. Let us start. Now, let us go to the topic presentation pictures and animations and tables. ANCA, that is anti-neutrophil cytoplasmic antibody. It is seen in venous granulomatosis or polyangiitis. Ash of bodies. Nodules in heart due to inflammation. This is seen in rheumatic fever. Batwing sign. This is the bilateral periheliar lung shadowing seen in frontal chest X-ray and CT chest. It will look like a wing of the bat. It is seen in pulmonary edema. Babinski sign. This is the abnormal plantar reflex. That is, when we tap to the sole of the feet, it causes extension of big toe instead of flexion. It is normal in infant and child, but in adults, it is seen in brain or spinal cord issues. For example, it is seen in brain tumor. Brudzinski's sign. The neck stiffness causes a patient's hip and knee to flex when neck is flexed. This is seen in meningitis. Banton's ring. It is the pathological retraction ring, an abnormal junction between two segments of uterus seen in obstructed labor. Butterfly rashes. It is usually seen in nose. This is the distinctive feature of SLE, the systemic lupus erythematosus. Bence-Jones protease. This is seen in multiple myeloma. Central dot sign. Tiny dots within dilated intrahepatic bile duct. This is seen in Caroli's disease. More details about this disease will be added in the upcoming videos. Clove cells. Clove cells are the vaginal epithelial cells that appear fuzzy without sharp edges under a microscope. This is seen in bacterial vaginosis. Cullen sign. Ecchymosis or bruising around the umbilicus. This is seen in GI bleed or pancreatitis. Gray Turner sign. Ecchymosis or discoloration of the flank. It is usually seen in acute necrotizing pancreatitis. Remember, Cullen sign and Gray Turner sign is the ecchymosis. The location you have to note. In Cullen sign, it is in umbilicus, and Gray Turner sign, it is near the flank area. Schwarzschild sign. It's the abnormal twitching of facial muscle when tapping on facial nerve. This is seen in tetany or hypocalcemia. Trossow's sign. Carpopedal spasm or inflating a BP cuff. This is also seen in tetany or hypocalcemia. Corrigan pulse is characterized by the abrupt distension and quick collapse of carotid arteries in aortic regurgitation. It's also termed as water hammer pulse, seen in peripheral arteries. Double bubble sign. Two air-filled bubbles are seen in abdomen in imaging, representing two discontinuous loop of bubble in small bowel obstructions. This is usually seen in duodenal atresia or obstruction. Next is flag sign. Flag sign is a discoloration of hair seen in kwashiorkor. See the figure 1. Flaky paint dermatosis. This is also a characteristic of kwashiorkor seen in figure 2. The fragile skin will peel off in an irregular manner. You can see the picture. Frog eye sign. It is seen when orbital structure shows characteristics of protrusion due to a fetal anencephaly. In second trimester, the typical appearance of anencephaly is frog eye sign, as shown in ultrasound image, due to the absence of cranial bone or brain and bulged eyes. Next is pigeon chest, a chest wall deformity due to the overgrowth of cartilage between ribs and sternum, causing the middle of the chest to stick out. Another name of pigeon chest is pectus carinatum. This is usually seen in rickets. Barrel chest. Barrel chest is a rounded, bulging chest that is similar to the shape of a barrel. This is seen in emphysema. Goer's sign. The child uses arm to walk due to weak lower limb. This is arm walking. Seen in BMD, that is Becker's muscular dystrophy. Homan sign. Calf pain at dorsiflexion of foot. This is usually seen in DVT and thrombophlebitis. Kerning sign. Hip or knee flex to 90 degree and during extension there is pain or resistance. This is usually seen in meningitis. Koilonychia or spoon nail. A deformity of nail where the central portion of nail is depressed and lateral aspect of nail is elevated. This is usually seen in iron deficiency anemia. The last portion of this session is Koplik spot. As somebody of you already aware that the Koplik spots are the spot present in buccal mucosa seen in measles or rubeola in a pre-eruption space. Now let us see about some memory tips and tricks for connecting the topics. This will help you to avoid confusion about various options in exam hall. Iron spoon. So it is the connecting link between spoon nail or koilonychia, iron deficiency anemia. Multiple Bence-Jones. So Bence-Jones protein is seen in multiple myeloma. Gray-Turner-Cullen pancreatitis, Gray-Turner syndrome or bruise in flank, Cullen sign, bruise in umbilicus, which are seen in pancreatitis. Then covers arm walking. SLE butterfly, Carolis central dot, vaginosis flu, Koplik measles, double bubble duodenal atresia. Here the D is highlighted for the common letter to memorize. Anencephaly, frog eye. Now let us see some common signs to the diseases. First one is tetany or hypocalcemia. In this case, both the Trousseau sign and Shostak sign is seen. Second is kwashiorkor, in which flag sign and flaky paint appearance of skin is seen. Third one is meningitis. In this, Kerning sign and Brudzinski sign is seen. Next memory tip is water Corrigan aortic regurgitation. That means water hammer pulse and Corrigan pulse is seen in aortic regurgitation. Ricketts PGM, emphysema barrel, covers arm walking. In Ricketts pigeon chest, in emphysema barrel chest and covers sign, arm walking is seen. These are all just some memory tips based on the options and connecting tips. You can develop your own memory tips based on your thought process and make it more interesting and share it. The answer key is given here. Please check your answers and redo the exam till you get 100% of the result. Thank you all for watching this video. Please add your valuable feedback. Subscribe this channel for more exam preparation videos. Thank you so much.